Hey my awesome people, this is Dr. Shivam and today we will be reading a very important topic from surgery. So time is very crucial for you now. The Neet PG is just on your head. You can just feel the time which is left for your Neet PG 2020. So you have to realize that the future which is going to come is belonging to the most competent one. So you have to become good, then better, and then the best. You have to keep on pushing yourself. You have to keep on giving extra efforts every day so that you reach one day where you can say that yes, you have done all the thing which was required and all the hard work was worth it. So do what you can with all you have and wherever you are. So with whatever things you have, start giving your extra efforts and you will be there where you are dreaming of. So you have survived everything till now and the best day of your life is still yet to come. So don't lose hope. Anyway, the future which is going to come will be the best part of your life up till now. So there are still people who you haven't met and things you haven't experienced. So there is a lot of beautiful things going to happen. Just keep little hope and be little positive and keep on pushing yourself. So we'll study today the breast carcinoma topic, which is the one topic which is going to come in every of your exam, be it Neet PG, AIMS or anything. And we will start with the discharges from the nipple. So first we will go through some of the important questions regarding nipple discharge so as to orient ourselves ki what type of questions are being asked. The first question is, blood stained nipple discharge is seen in breast abscess, fibroadenoma, ductal papilloma, fat necrosis of breast. Bleeding from nipple is seen in, so it's a PGI type multiple question. Green discharge is most commonly seen with. So don't worry with the question, just listen the question. We will come to what is all you have to know. A 25-year-old female complains of discharge of blood from single duct in her breast. Most appropriate treatment would be a radical excision or a microdocectomy. True statement about nipple discharge is R. Mammography, cone excision done in single intraductal tumor, and so on. A 25-year-old lady presented with spontaneous nipple discharge for 3-month duration. On examination, the discharge is bloody and from a single duct. Following statement about management are true. So now we will go into what all are required to know to answer this question. So the first question was regarding nipple discharge. So seeing the color, you can guess what all can be the pathology. In blood stained discharges, you will get in ductal papilloma, intraductal carcinoma of breast, and duct ectasia. Serous will be in fibrocystic disease, duct ectasia, and carcinoma. Now something which is very peculiar of duct ectasia is black, green, paste-like or grumous discharge. It's always duct ectasia for your Neet PG examination. So most common cause of greenish discharge is duct ectasia, and most common cause of blood stained discharge is duct papilloma. So now I think you can answer some of the question. That is, if I go to the first question, which was blood stained nipple discharge is seen in, so among these the answer is ductal papilloma. Bleeding from nipple is seen in, it's a PGI type question. So here the answer will be duct ectasia, ductal papilloma, and CA breast. Green discharge is most commonly seen with, it is duct ectasia. So see, now you can answer these, and these are something which have been asked in multiple examination. A 25-year-old female complains of discharge from the blood from a single duct in her breast. Most appropriate treatment. So this is something which is again and again asked in the examination, and the answer is microdocectomy and not radical excision of the single duct. So never and never you do a radical excision. Always for diagnosis you do a macrodocectomy and not a radical excision for the duct. So note it down. Other thing is true statement about nipple discharge is our mammography is true. Cone excision done in single intraductal tumor, true. Mammography done with duct papilloma less than 4.5, this is not a criteria, not true. Red discharge indicate malignancy, yes, it can be. Red discharge means bloody, that is a carcinoma, ductal carcinoma. Blue black discharge indicate duct ectasia, yes, you know. So the answer here will be A, B, D, E. A 25-year-old lady present with spontaneous nipple discharge for 3 months duration. On examination, the discharge is bloody and from single duct. Following statement are true except ultrasound can be useful in investigation, true. Radical duct excision is the operation of choice, never we do a radical duct excision. Galactogram, though useful, is not essential, true. Majority of blood stained nipple discharge are due to papilloma, other benign condition, true. So now you can answer most of the questions regarding nipple discharge. We will know little more about nipple discharge, like if it is a unilateral spontaneous serous or serosanguinous discharge from single duct, it is caused by intraductal papilloma and rarely by a cancer. So mostly the underlying cause is duct papilloma or duct ectasia, but since the chances of malignancy are high, it must be investigated further, and risk of malignancy is increasing if there is underlying mass present. Okay, so other thing is what all investigation you will do. So a mammography can show you a suspicious lesion. Later we will know when to do mammography, when to do USG, and when to do which investigation in particular. So ductography is the primary indication in case of nipple discharge, particularly when the fluid contains blood. What we do here is we give a radio opaque contrast media into one or more of the major duct and mammography is performed. So in this, if it is an intraductal papilloma, we will see a small filling defect surrounded by a contrast media. In cancer, it will be irregular masses or multiple intraluminal filling defect, and in case of ductal ectasia, it will be peculiar dilated cystic structure. Okay, so final diagnosis is made always by microdectomy, that is we need something to do the histopathology. Okay, and for that we do microdocectomy and never a radical duct excision. So firstly we have to exclude the carcinoma by occult blood test and cytology, and then simple reassurance may be sufficient. If the discharge is proving intolerable, then only we remove the affected duct, that is by microdocectomy. So don't forget microdocectomy. Moving to some other questions regarding the diagnosis. Best diagnosis method for breast lump is, just know the question, we will go into detail and then come back to the questions. A 45-year-old woman present with hard and mobile lump in the breast, next investigation is a female patient present with hard mobile lump in her right breast. Which investigation would be most helpful in making the diagnosis? Investigation of choice for high risk breast cancer in case of female is high risk. Gold standard investigation for screening breast CA in patients with breast implant. So you have to keep in mind every word which the examiner want to ask you. So do read the question full. A 60-year-old lady comes with blood stained discharge from nipple with family history of breast CA. Next best step for her will be. So best step is asking. So we'll see something more, that is what is triple assessment for breast. So triple assessment includes a combination of clinical assessment, radiological imaging, and a tissue sampling analysis. Radiological, it can be USG, mammography is better, and sampling can be FNAC or biopsy. So the positive predictive value is 99.9%. Now something about breast cancer, because it is very important. So it is the most common cancer in urban women in India. If you say overall most common cancer in women in India, it will be CA cervix. So the most carcinoma are arising from the terminal duct lobular unit, that is the adenocarcinoma. And if you see most common type of CA breast, it is invasive ductal carcinoma serous type, and most malignant type of CA breast is If they are asking most malignant type of CA breast is not most common. Most malignant type of CA breast is inflammatory breast carcinoma. Most common size of CA breast is upper outer quadrant left more than right. Most common site of metastasis is bone, and among bone, the osteolytic deposits occur in lumbar vertebrae, then femur, then thoracic vertebrae, then ribs, and then skull. And metastatic disease is the principal cause of death in a case of breast cancer. What happens is it leads into a malignant pleural effusion and other metastasis diseases. And second most common cause of cancer related death in women is the breast cancer, and most common in both male and female is CA lung, but second most common is breast cancer. So if you see clinically, the breast cancer may be asymptomatic early breast cancer, and symptom indicate a possibility of breast cancer. How? Which symptoms? If there is change in size and shape of the breast, skin dimpling, nipple retraction, single duct discharge, particularly blood stained, and axillary node enlargement. So symptoms indicating of metastasis like breathing difficulty, bone pain, hypercalcemia, abdominal distension, jaundice, these also indicate metastasis. Triple evaluation, and it is very basic and important question, you cannot do wrong in it. And if you ask me what is the first investigation, it is FNAC, best and diagnostic investigation in a case of breast pathology or CA is the biopsy. Best is biopsy, but the first is FNA. Okay, now most common cancer in India for women is CA cervix as told, and most common cancer in urban women in India is CA breast. Most common cancer women world is CA breast, and most common cancer related death in men and women is CA lung. Second most common cause is CA breast for death. Now, as we have already told, the mammography is the best. The mammography is the radiological investigation or the initial investigation for symptomatic breast in women greater than 35 years of age, and it is a screening test. Now, when you use ultrasound, it is the initial investigation for palpable lesion in women less than 35 years. So, in less than 35 years, why this mammography is not being used? Because it has some drawbacks which we will discuss. So mammography is as such in investigation of choice for microcalcification, and the other thing is it is the MRI is, so mammography, now MRI is something which is now being used for implants. Other thing is high risk patient, scarred breast, borderline lesion for breast conservation, and means if we are going for breast conservation we have to do MRI, and the investigation of choice for implant related complication is MRI, and gold standard for imaging breast in female with high risk and implants is MRI. So PET scan, when you do a PET scan, this can be a good question for your examination. It is done when there are chances of recurrence in scarred breast. So investigation for detecting recurrence in scarred breast. So once you have operated, you are suspecting a recurrence, do a PET scan. So useful in multifocal disease and helping detecting the axillary involvement. So when you do ultrasonography, you already know less than 35 year young, because the young women breast contain large proportion of glandular tissue which appears as soft tissue density, and thus it lowers the sensitivity of mammogram. So you do a mammogram in greater than 35 year of age, and the sensitivity of ultrasound for detecting a ductal carcinoma in situ is significantly lower than mammography. That is why ultrasound is not used for DCIS, but mammography is the best for DCIS. It is a separate question. So when you use a ultrasonography for just defining a cystic mass and in less than 35 year of age, and just like that, but the most of the question will be asked to you with the MRI, mammogram, and PET scan. So we'll move to the questions we were discussing, and I believe you will be able to answer it now. So best diagnostic method for breast lump is If we see the options, USG, mammogram, biopsy, FNAC, so obviously it will be a biopsy because it is the best. A 45-year-old woman present with hard mobile lump in the breast. Next investigation is, now it is asking next investigation. So here you can perform a 45-year-old, so you can perform a next is FNAC. A female patient presents with hard mobile lump in her right breast. Which investigation would be most helpful in making a diagnosis? Most helpful? No, FNAC, no. Needle biopsy will be the most effective or most helpful in making a diagnosis. We don't do excisional biopsy because it is more invasive. Investigation of choice for high risk breast cancer in female is, you already know, high risk means MRI. Gold standard for investigation of screening breast cancer in patient with breast implants, again MRI. Implant is MRI. 60-year-old lady comes with blood stain discharge from nipple with family history of breast cancer. That means this female is high risk, so you have to do an MRI. So you have to do a MRI. So this completes most of the important discussion from the breast carcinoma initial part and the nipple discharge. So what all they can ask, this was more than sufficient, and I think you will be giving your everything for your examination, because this is the time which is not going to come back to you. And don't get demotivated. You are already a doctor, you have already a degree which most of the people just dream of. So you are already a MBBS doctor, and just you are giving your full efforts for becoming a more qualified one. So this is Dr. Shivam signing off. Stay happy, stay motivated, and do whatever you want to do. Thank you.